So welcome to this next mini lecture in this course on cluster randomized designs in cancer care delivery research. So in this next session, I'm going to provide an introduction to what we call the multiple period cluster randomized trials, which might otherwise be known as longitudinal cluster trials. Okay, so in this session, we're going to start by thinking about some standard alternatives to the parallel arm cluster trial. And these include a cluster randomized trial with what we call a baseline period and a cluster randomized crossover design. Because of the longitudinal nature of these extensions, this also means that we need to think about the concepts of repeated measures. And so we'll think about adopting what we call cohort sampling and also cross-sectional sampling. And then we're going to start to think about the competing trade-offs between logistics, how logistical feasible these types of study designs are, and statistical efficiency. And then we'll start to think about the choice of design. But sessions 3 and 4 will cover the choice of cluster design in more detail, and this session will really just outline the options for the different types of study designs. So let's start by taking our minds back to the conventional parallel cluster randomized trial. So remember, in this type of design, clusters are randomized, either treatment or control condition. And in our schematic representation here, we've got 10 clusters allocated to the control condition and 10 clusters allocated to the intervention condition. So under this type of study design, every cluster is allocated and also contributes data either under the control or the intervention condition, but not both. But in other variations of the cluster design, clusters can contribute observations under both control and intervention conditions. And it's these types of designs that we're going to explore in this session. So the first of these is what's known as a cluster randomized trial with a baseline period. And we're going to use the acronym CRT-B. So the CRT with a baseline period, in this type of trial designs, clusters are first observed for a period of time under the control condition. So that's here. So all of our 20 clusters are observed under the control condition. And then at a point in time, typically around halfway through the study design, in what we call the post-rollout period, half of the clusters are allocated to the control condition, and the other half of the clusters are allocated to transition to the intervention condition. So whilst we might talk about control arms and intervention arms, actually control arm clusters, whilst they receive only the control condition, those clusters allocated to the intervention condition actually contribute data in the pre-rollout period from the control condition and in the post-rollout period from the intervention condition. The appeal of this type of design is its statistical efficiency. It probably, and in most settings, reduces the overall sample size for the same amount of information. We're going to look more at statistical efficiency in session 4. Now, in cluster randomized designs with baseline periods, we have a choice between whether we might implement the study design using what's known as cohort sampling or using what's known as cross-sectional sampling. Now, cohort sampling is much like what happens in a patient randomized trial with repeated measures. So in a cohort sample, the same participants are measured both under the control condition and then the intervention condition. And so we might say that the participants and the clusters are repeatedly measured. Whereas in cross-sectional sampling, this starts to differ a little bit to patient randomized trials, because in a cross-sectional sample, different participants are measured under the control and intervention condition. So whilst clusters are repeatedly measured, participants are only measured once. So let's think through a couple of examples of cluster trials with baseline periods. So the first example is an example of a cluster randomized trial with a baseline period that adopted a cohort sampling mechanism. So this means that the same participants were measured in the same 2 measurement periods. And about 70% of cluster trials use this type of cohort sampling. So for example, if cancer symptoms are measured at baseline and then they're measured again at 11 or 12 weeks of follow-up, this could be a cluster randomized design with a baseline period. And in this type of setting, participants are measured twice at baseline and at follow-up. And so it's a type of cohort sampling structure. Whereas in a cross-sectional sampling setup, the different participants are measured in the 2 different periods. About 30% of cluster trials with a baseline period use cross-sectional sampling. So an example here is, for example, where the outcome is time to diagnosis, perhaps cancer diagnosis, and it's measured in 600 people in the post-rollout period and a different 150 in the pre-rollout phase. Sorry, small typo there. So let's move on to think about the cluster randomized design with a crossover setup. So in a cluster randomized crossover design, and here we use the acronym CRXO, clusters are allocated to sequences. So here's sequence 1 and sequence 2. And these sequences dictate the order of the sequence of the treatments. So clusters allocated to sequence 1 first are observed under the control condition and then transition to the intervention condition, whereas clusters allocated to sequence 2 are first observed under the intervention condition and then transition and are observed under the control condition. So typically cluster randomized crossover designs have 2 sequences and 2 periods. So clusters allocated either sequence 1 or sequence 2, and then clusters observed during what we might call period 1, and then again under period 2. Now this type of trial design has many appeals, and these appeals are to do with the within cluster comparison. So every cluster is observed under both the control and intervention condition, and these within cluster comparisons make for a statistically efficient design, essentially reduces the effective sample size, increases the effective sample size. Now in a multiple period cluster crossover design, clusters repeatedly transition between the intervention conditions. So in this example here, clusters allocated to sequence 1 start off under the intervention condition, then switch to the control, then switch back to the intervention, and so on. And this design has 6 periods. But multiple period cluster crossover designs could have as many periods as you wanted. Under sequence 2, they receive the opposite. They are observed first under the control, then switch to the intervention, then again under the control, and so on. So this bidirectional crossover of clusters, transitioning from control to intervention condition and then back from intervention to control condition. It can be a logistically more challenging design to implement because this intervention has to be repeatedly taken away from practice and then put back into practice. So this can make it logistically challenging, but it has an appeal, and that is the more crossovers, the greater the statistical efficiency, up to some sort of limit. But we have to be cautious when using this type of study design, not only because of the logistical issues with repeatedly transitioning between intervention and control conditions, but also because the intervention must be able to be withdrawn from the cluster relatively easily to avoid what are known as carryover effects. So cluster randomized crossover designs are limited when it is possible to withdraw the intervention, and it won't be suited to behavior change type of interventions. And even in some studies where it might be feasible to withdraw the intervention from practice, these types of study designs might need to embed what are called washout periods to allow for a transition between the 2 treatment conditions. And we'll come back to transition periods when we're thinking in more detail about how we set up these designs in session 3. So here's an example of a cluster randomized crossover design. It's called the PADIT trial. It's published in 2018. It included high-risk patients who were undergoing a commonly used procedure for cardiac rhythm device implementation. Under the control condition, the patients received a single dose of preoperative antibiotics. But under the intervention condition, they received a strategy of incremental prophylaxis. There were 28 hospitals, the hospitals were the clusters, set in Canada and the Netherlands, and they were observed over a 24-month period. The primary outcome was hospitalization for device infection. So the first 14 clusters were allocated to the first sequence, and under the first sequence, clusters were observed for 6 months under the intervention condition. Then for the next 6 months, they switched over to the control condition, then back to the intervention condition, and then finally, for the last 6 months, they were observed under the control condition. Clusters allocated to the second sequence were first observed for 6 months under the control condition, then switched to the intervention, then back to the control, and for the last 6 months, they were observed under the intervention condition. Now, the popularity of the cluster randomized crossover design is also growing. There are not as many cluster randomized crossover designs as cluster trials, because after all, this is a subset of cluster randomized trials, but its popularity is also growing, as we saw that the cluster randomized trials popularity is also growing. In a recent review and assessment of cluster randomized crossover designs published up to and including 2016, we observed similar things as we see when we look at the characteristics of parallel cluster trials. They typically don't include many clusters. So the typical cluster crossover design trial only includes 8 clusters, and 75% of cluster crossover designs were observed to contain fewer than 21 clusters. Vast majority of cluster crossover designs include just 2 periods, so 70% of the published cluster crossover designs just have that 2-sequence, 2-period design. Average cluster size is also pretty small. Average cluster size was just 27, interquartile range going from 14 up to 77, so it's typically smaller than the conventional parallel cluster design. So in summary then, just like patient randomized trials, cluster randomized trials can include repeated measures. And so 2 typical examples of cluster trials which include repeated measures are what is known as the cluster randomized trial with a baseline period and the cluster randomized crossover design. So these designs include, by definition, repeated measures at the level of the cluster, but they may or may not include repeated measures at the level of the individual. And that depends on whether the trial has adopted a cohort sampling mechanism or a cross-sectional sampling design. There are lots of pros and cons of cluster randomized trials with repeated measures. They increase statistical efficiency, but they're logistically challenging, and they're also limited to settings where the intervention can be removed. And that's because they require this bidirectional crossover. The stepped-wedge design is what we might refer to as a unidirectional crossover design, as is the cluster randomized trial with a baseline period. It's not as statistically appealing as the cluster crossover design, but it can have lots of logistical appeals. We're going to go on to look at this in the next session. So these are the methods references that have been cited throughout this mini lecture. 2 more methods references here, and these are the study references, the references for the case studies that have been cited. And then up next is going to be a session on the introduction to the stepped-wedge cluster randomized trial.